Good afternoon, everyone, and thank you for the opportunity to speak with you today. My name is Stephen Scheuer. I'm a PGY2 psychiatric pharmacy resident at the Madison VA.
And my name is Courtney Putz, and I'm a first-year administrative pharmacy resident at the Madison VA as well.
Today's webinar will focus on scenarios all of us have encountered in practice, patients who are non-adherent. Sometimes it can be a struggle to identify the root cause of a patient's non-adherence, whether it is unintentional, related to socioeconomic factors, or due to a lack of knowledge. Neither Courtney nor myself have any actual or relevant financial disclosures. After this webinar, participants will be able to compare and contrast current patient interactions with the Motivates mnemonic, apply Motivates to practice settings in the community, at an institution, and in the ambulatory care setting, and they will be able to identify ways to incorporate adherence interventions into your practice setting. Now, as we've stated, this webinar is how to apply the Motivates mnemonic into clinical practice. For review of the Motivates mnemonic, the background on it and what each of those letters in the mnemonic stand for, please see the previous webinars in this series. We will start our case series in the community setting. In our example, you are a pharmacist and you have received an e-script for lisinopril 40 milligrams daily for HI hypertension. Per your pharmacy records, Mr. Pretension has multiple strengths of lisinopril on file, all of which were only picked up once and then never refilled. The most recent prescription was 6 months ago for lisinopril 20 milligrams daily. Unfortunately, your site doesn't have access to his electronic health record, but you know that this is the only pharmacy at which he fills his prescriptions, as he consistently refills insulin. Mr. Pretension is waiting at the consultation window to finish his purchase of the lisinopril. In this interaction, we will discuss maximizing rapport and opening the discussion from the Motivates mnemonic. Good morning, sir. It looks like you're picking up lisinopril 40 milligram tablets today. When I was reviewing our pharmacy records, it looks like it's been about 6 months since you last picked this up. I know many patients have issues remembering to take their medications. How often in an average week might you miss taking this medication?
I miss lisinopril most days of the week. I know I should be doing better about taking it.
As the pharmacist, what should be your next step? Now, I want to go back and review that this is a non-judgmental opening and that the pharmacist used an open-ended question as a way to open the conversation and open the floor to talking about adherence issues. The pharmacist stated, I know patients have a lot of different reasons for potentially missing meds. What issues are you having, or how often might you miss a dose in a week? This is a non-blaming statement and allows the patient to feel as if the pharmacist is a partner in their health care rather than being confronted. Here's where the Motivates mnemonic comes into play. We've already done the M and the O portion. Now we will go into the T and the I section, which is tune out the bias and involve the patient. Now, before I delve into each of those, I also want to reemphasize that the Motivates mnemonic is just that. It's a mnemonic, and it's not necessarily split into the distinct sections that we will talk about in this webinar. Some of the sections merge together in conversation, and they might even be out of order, and that's okay. In this case, tuning out the bias, there may be many reasons why someone may not be taking medications as prescribed. In order to figure out what might be this patient's reasons, you do want to use open-ended questions to find out more information. And these are questions that cannot just be answered with a yes or a no. These are ones similar that we were taught in pharmacy school and when we're interviewing patients. These examples are: what difficulties have you had fitting medications into your schedule or your routine? Or how are the days when you take your medications different from days you don't take your medication? This allows the patient to extrapolate more and allows you to make more of an impact rather than do you miss your meds? And it's important that you do not use guilt to force the patients into adherence, because guilt breaks the trust that the patient may have with you. An example, one that you should not use, is high blood pressure puts you at increased risk of heart attacks and stroke. You wouldn't want that to happen, would you? After using this motivates mnemonic and having communication with this patient, Mr. Pretension admits he doesn't see a reason to take his lisinopril, as he doesn't feel any different on it, whereas he can tell when he has high blood sugar, so he knows when he doesn't take his insulin. What would be the next step in this setting? Which takes us to the next portion of the motivates mnemonic, the VAT portion. The VAT portion is vested interest, allows silence through active listening, and takes time to build trust. So let's start with the vested interest portion. This is not only our verbal cues or our verbal interactions, this includes also nonverbal cues. As part of the verbal cues, we'll talk a little bit about reflective listening. So some examples of reflective listening on this patient are: it sounds like if you don't see the effects of a medication, you don't see a reason to take it. The reason why this is a reflection is the patient just stated, I don't feel any different on this blood pressure medication, whereas I do feel different on the insulin. And that's why you would then follow it up with, if you had a way to see improvement, you would be willing to take the medication more regularly. In addition to those verbal cues, nonverbal cues are just as important. Maintaining good eye contact, smiling, and nodding. By showing you have a vested interest, by allowing the patient to tell you how they're feeling and how they feel that this treatment is working for them, it allows you to build trust, and it makes them feel heard. And by not marginalizing their thoughts and beliefs as other providers may, this will allow you to make a larger impact on this patient's health care. After this interaction, Mr. Pretension agrees that if he saw benefit from his lisinopril, he would be more likely to take it on a daily basis. And this is where we hit the last few parts of the motivates mnemonic. We're going to hit the E letter: evoke enthusiasm and empower the patient. For those of you who have studied motivational interviewing or potentially heard about it in a previous webinar in this series, motivational interviewing, one of its main components is evocation. And that one of the ways that you do that is emphasizing patient autonomy. Now, we won't get really into all of the facets of evocation today, but one of the main principles we want to discuss is the communication principle of MI. And that's supporting the patient's self-efficacy. Everyone is their own decision maker. Everyone has their own decision-making capacity. And if you order someone to do something, you're marginalizing their own ability to make that decision. A common mistake that a lot of practitioners make is rattling off education and information, which patients may interpret as that you are feeling more powerful than they are, more knowledgeable, so you're marginalizing how they feel. So although in certain circumstances it might be important to give information or advice, using the principles of motivational interviewing, you want to ask for permission before giving that advice. In that way, the patient feels empowered that they are the ones asking you for that, rather than you just telling them. So how would this look in the community setting, in this exact circumstance? So the pharmacist would say, you want to see the results of treating high blood pressure similar to the way that you treat your diabetes. You are actively involved with your health as you take a complicated medication like insulin. This is something called an affirmation right here. showing a patient that they're already doing something really well. I have some ideas on how we could show benefit from your blood pressure medications. Would it be okay if I shared those with you? This is the asking permission portion, so the patient feels that they're the ones in control of this interaction. After you describe how to check daily blood pressures to see the effects of his blood pressure agent, Mr. Pertension is willing to try to take his lisinopril on a daily basis. Now you can see how far we've come with this patient. This is someone who, after reviewing the patient profile, seemed very non-adherent with their lisinopril regimen, and we really had no information on why that is. Using the Motivates mnemonic, where we opened the discussion with open-ended questions, tuned out the bias, showed that we had a vested interest in the patient, which allowed us to build trust, and then evoked enthusiasm and empowering the patient, this patient is now willing to take his lisinopril on a daily basis and monitor his blood pressures, which will allow his primary care provider to better maximize his regimen. Now, this was a community setting example. We will move into now an institutional example. You are scheduled to perform a medication reconciliation on the new admission to the medical floor, BD Hart, who's a 60-year-old female with type 2 diabetes, a history of multiple myocardial infarctions, most recently in July of 2016, and tobacco use disorder. I should state that when you're doing this medication reconciliation, this was in January of 2017. While you were performing the medication reconciliation, Ms. Hart admits that she hasn't taken her atorvastatin in 3 weeks. Now we will go into the interaction that you, the pharmacist, are having with BD Hart, and we will use the MOT part of the Motivates mnemonic. I think it's important that the T, the tune out the bias, is actually the first thing that you do, because having these preconceptions when you go in to talk with a patient can actually hinder you opening the discussion and maximizing the rapport. So going in with an open mind and just kind of looking for information, just kind of being curious. So now we'll take it away with the interaction.
Taking medications every day can be difficult. Why did you stop taking your atorvastatin?
I just can't remember to take my atorvastatin at bedtime. I take all of my other medications at breakfast. There are 10 of them, and I never forget those. Nothing bad's happened yet, so it looks like I might be okay not taking it. But I'm also worried about having another heart attack. Now in this MOT portion, the pharmacist normalized the patient's experience and opened the floor for discussion. Now we'll move on to involving the patient, showing a vested interest, and allowing silence through active listening.
You've already done so much for your health. You take 10 medications like clockwork, and you haven't seen bad effects from missing the atorvastatin.
Now this comment that the pharmacist just made highlights a few different MI communication principles, as previously discussed in a previous webinar. Develop discrepancy and rolling with resistance. Now, the discrepancy here is the patient just said that she does so much for her health, that she's very worried about having a heart attack, yet she is not taking a medication that would lower her risk of a future heart attack. It's important to kind of highlight this and show that back to the patient, basically holding up a mirror on what they just said and allowing them to evaluate, is that really what I believe? This patient is not truly very resistant. It seems to be a patient who just kind of has trouble remembering to take a medication at bedtime. You will experience patients much more resistant to change than this patient. It's important to think about in those situations to kind of check away your preconceptions and just keep reflecting back to the patient. This is what you're telling me. This is what I'm hearing. Does that sound right? And connecting to the values that they may have expressed already.
However, it sounds like you're worried that missing it might cause another heart attack.
So this is the second portion of the reflection from our pharmacist, highlighting that she's worried, the patient is worried about having another heart attack despite not taking this medication. And it's the reason that it was structured this way was it allowed the pharmacist to end on the note that highlights the reasons for change. In a conversation, when you're reflecting back to a patient or to a person in general, the last thing that you say, the person is more likely to pick up on. So that's why we end with the reason for change. After this discussion with Ms. Hart, she adds that she's had issues in the past remembering medications, and that's why she takes 10 medications at once in the morning. Now, this is an important part where we would evoke the enthusiasm and empower the patient, and also show empathy.
You've struggled with missing medications before, but you've figured out a way to take all your medications that works with your life. Now you're looking for a way to do that again.
Going back to motivational interviewing, this is the principle of supporting self-efficacy. So basically showing the patient, you've done this before, you can do it again. It gives the patient more confidence in their ability to make this change.
Other patients have shared with me how they remember to take medications. Would you mind if I shared that with you?
And this is another communication principle which we discussed in our previous case, asking for permission before giving advice. Remember, this is empowering the patient. This is allowing them to be the decision maker in the conversation, and it makes them feel like they're the ones telling you to give them advice, rather than you just explicitly telling them. After this interaction you had with Ms. Hart, and discussing that atorvastatin can be taken with her other medications in the morning, and that she may have thought that she only could take it at bedtime because the old statins could only be taken at bedtime, Ms. Hart happily agreed to move the atorvastatin into the morning slot of her medication box. This is another situation where we use the motivates mnemonic. We open the discussion after tuning out the bias, so we have our own conceptions of how patients might be thinking, what their motivations might be, but you have to put those thoughts aside. In this case, the pharmacist opened up the discussion by saying, taking medications every day can be very difficult. Why did you stop taking the atorvastatin? Then showing a vested interest in the patient by using reflective listening. And then also evoking enthusiasm, empowering the patient. You've done this with your other medications. You can do this again. And this allowed Ms. Hart to become more adherent with her atorvastatin. Our final setting is in the ambulatory care setting. So this is a medication management clinic appointment with our patient DM, who is a 50-year-old male with type 2 diabetes, peripheral diabetic neuropathy, and hypertension. Prior to his appointment, you review his health record, and you notice his A1C has remained stagnant, around 12% for the last year. And because of that, his diabetic neuropathy has been getting worse. You also look at his refill history because you have access to his refill records, and you realize that he hasn't filled his 30-day supply of Lantus in over 3 months. Now, we've already gone over a couple cases, so I wanted, rather than tell the audience here what the most appropriate way to open the conversation would be, I thought this would be a good assessment question. So which of the following is the most appropriate way to open the conversation about DM's non-adherence? A, why aren't you taking your Lantus? You know your neuropathy is only going to get worse. B, your 30-day supply of Lantus seems to last you quite a while. You know, if you can't afford it, we can find a coupon card for you. C, I noticed you haven't refilled your Lantus in over 3 months. Have you been using your insulin? D. I noticed that you haven't refilled your Lantus in over 3 months. Many patients of mine have issues fitting insulin into their routines. How have you been using your Lantus? So I'll let you go ahead and think about which answer may be the correct answer. The answer to the assessment question is D. The reason for that is A. Basically shows that you're using guilt to force the patient into adherence. Not a very good way of opening the conversation, which would throw the patient on the defensive. The answer is not B, as in boy, because you're already making an assumption that the patient can't afford it. C, this actually isn't the worst answer, but it's not the most correct answer because this is a closed-ended question. This would be yes or no. Have you been using your insulin? So the answer comes to D. Basically, it talks about the patient. You are making an observation. Then you say, many patients of mine have issues fitting insulin into their routines. How have you been using your insulin? This is an open-ended question, and it allows the patient to kind of give you their reason why they may not be filling their Lantus as regularly. So this slide kind of goes into a little more depth on why the answer on the last slide was D, using the MOT portion of the motivates mnemonic. The pharmacist maximized rapport by normalizing the issue with the insulin by including that other patients also struggle using insulin. The pharmacist used open-ended questions in order to communicate better with the patient, and also tuned out the bias. They did that by asking the patient how they use their insulin without assuming why they aren't taking it. And this is important because if the patient is made to feel bad about being non-adherent, it can break the alliance that the patient and the pharmacist may have, and it can kind of destroy the trust that the patient will have for the pharmacist, and they may be less likely to come to you for issues in the future. Now, DM admits after this discussion that he's been taking less than half of the insulin dose that's prescribed. This is the portion where you want to allow silence through active listening and also getting invested in the patient. Rather than going through an entire exchange, this is the third case, I'm just going to summarize what happened. After many open-ended questions and letting DM lead the conversation, DM admits he had a few hypoglycemic episodes 2 months ago and is afraid of going low again, which is why he isn't taking the insulin as prescribed. This is where it's important to do the next portion of the motivates mnemonic. The first thing you may notice from this slide is that the motivate steps are out of order of the mnemonic. That is okay. Remember, as I've said multiple times throughout this webinar, sticking to the mnemonic in order is not a necessity. You can alter it to how it flows best in the conversation. So in this case, the patient had just told you that he had a few hypoglycemic episodes, and that was why he cut back on his insulin. So by showing empathy and saying hypoglycemic episodes are scary for many patients, especially those who are worried about falling, that shows concern and validates the patient's concern for future hypoglycemic episodes. And by showing that you actually care about the patient, that will inherently build trust between you and the patient. Then to involve the patient and get a vested interest in the change that you're trying to do, you could say, if we could have you on an insulin regimen where you weren't having low blood sugars, how would you feel about taking insulin as prescribed? And then evoking the enthusiasm and empowering the patient. So affirm that he's invested in his health since he continued to take insulin despite hypoglycemic episodes. I'm sure we've all had a patient who has stopped their insulin altogether because they're so worried about having lows or falling. So just affirming that, he's been doing really well. He's been taking his insulin despite having these scary episodes. And empowering him that to continue this investment he's already made by ensuring a safer insulin regimen. Now this builds a relationship between you and the patient, and he might be more willing to come to you in the future when he's having hypoglycemic episodes, rather than waiting for months before coming back for his appointment. This concludes the 3 different practice settings, the 3 different cases we are going to talk about. I'm now going to turn it over to for the second portion of this webinar to Dr. Poots.
You may recall in the first webinar of this series an introduction to the PSW Adherence Toolkit. As we discuss incorporating adherence encounters into your practice setting, we will dig deeper into the toolkit and the supplemental materials available for your use to streamline incorporation of adherence interventions into your workflow. While walking through the tools available, we will review how the motivates mnemonic and aspects of motivational interviewing are incorporated into the workflow and the materials provided. Screening for non-adherence is a great place to engage your pharmacy technicians and learners that may be at your practice site, including introductory practice students or advanced practice students, maybe even interns. Technicians may screen for non-adherence by reviewing a patient's refill history, while waiting for prescriptions to be filled or prior to completing a comprehensive medication review. Ask patients to complete the Making the Most of the Medications form. This will be reviewed on the next 2 slides. Technicians can explain how the form will help improve the pharmacist's understanding of how the patient is managing their medications at home. On the Making the Most form, the images next to each screening question designates which barriers to focus on in the toolkit. This, therefore, provides areas to further discuss with the patient. If areas of non-adherence are identified, the technician may place a trigger form into the bins or bags for patients who have late fills or those with identified adherence concerns. So this slide shows the first half of the Making the Most of My Medications form. And as you can see, it's very patient-friendly and first identifies what patient is taking the medications for, and they're able to select multiple chronic disease states. It also is a screening question that will help give the pharmacist more information. How often do you forget to take your medications or forget to take a dose? This is one of those key screening for non-adherence. The second half of the screening form further addresses concerns with adherence. The comments section also allows patients to self-identify ways in which the medication plan may be improved. So you can see right from the start, this intervention is very patient-focused. It allows a patient to identify barriers, make you aware of how often they're missing doses, and also able to self-reflect and create their own solutions. This increases self-efficacy and patient buy-in because they feel like they're being involved from the process right from the beginning. Since this is basic information gathering as well, this allows the pharmacist to open the conversation in a welcoming manner with the patient and already have an idea of what's going on. The next step in the toolkit is assess and address. So there's another nice supplemental material which helps walk you through this. This is what the trigger form will be. So let's say you've done a profile review or a technician has identified a patient with adherence issues. This form can be placed in bins or bags when a patient picks up their prescription. And this will help engage the patient in adherence discussions and further gather information from the patient. Overall, this will help you build rapport and also help drive that change with the patient. This is the assess and address in 5 minutes or less form. So this form has either been put in bags or bins for patients who have been identified to have gaps in their refill history or have identified a need for improving their adherence. You can see the first question here, the first step is an open discussion. So just welcoming the patient to share with you some concerns they have or what's been going on at home. It's a non-judgmental view and will right away make the patient aware that you're there to listen to them. The second question helps them reflect too about missed doses and when they may happen, and trying to figure out what the patient's biggest challenges are. The last question here gets to the root of if they feel their medications are working for them, and also gets to the point of home monitoring and how they may see benefit in measuring blood pressure or blood sugar, for example, to have evidence that the medication is working for them. So you can see these questions really focus on further investigating the motivations the patient has, what they're currently doing, what may be working well, and what may not be working well. The next step is solve and involve. So using this process will help develop an individualized medication action plan. We've already identified adherence barriers with the patient, and this will be a useful reference guide that can help pharmacists work with the patient to develop that action plan together. The goal is to actively involve them to determine what the target behavior is and to help the patient identify their own specific goals. When transitioning into the planning stage, it may be useful to summarize your discussion up to this point. You may want to include what is important to the patient, repeat back any change talk you heard during the discussion, and the identified barrier. So for example, just to make sure I understand you, it sounds like controlling your blood pressure is important to you to prevent another heart attack. Due to your work schedule and taking care of your children, who are really important to you, it has been hard for you to focus on yourself and taking your medications every day. So in that brief example, you've stated back the difficulty for adherence, why they feel like taking their medications is important to them, affirmed something that was important to the patient, such as their children, and also identified that barrier that the patient would like to improve. The next step would be to develop a SMART goal with the patient, including what behavior, when they would like to see the behavior fit into their schedule, and a start date when they would like to enact this new behavior. It also may be helpful to identify who may help and support them at home with this plan. So whether they have spouse, children, friends, or family they'd like to be involved in, helping gain their support in this process. Next, getting a list of a commitment statement can be helpful. So just make sure that you and the patient are on the same page and have a similar understanding. Having the patient repeat back too can solidify that plan for them. So this is the second half of the solve and involve form. The remainder includes determining a patient's confidence in change. So for example, how confident are you in completing this plan? You can use a scale here from 0 to 10. That can help you get an idea of where the patient lies. And something else, by using the scale, you can ask if they answer 5, for example. Why do you say 5 and not a 4? This can help you identify, why they feel they're confident and how they feel they may be successful in the future. Helping talk through barriers to the plan as well and a solution to those barriers can also help start that problem-solving process, because as we know, with life, barriers will come into the patient's way. Also summarizing that plan at the end, so really going over it again, including the start date to help make sure that you're both have a similar understanding. Follow-up is important to make sure that there is an accountability, and also if issues have come up, you have a time where it can be discussed in the future. In addition, filling out the My Medication Plan with the patient helps identify possible resources needed for the patient to be successful while implementing this change. This is the My Medication Plan that's also one of the supplement materials with the adherence kit. This is something you could have the patient fill out with your assistance. As you can see, this worksheet involves all aspects of SMART goals, including what, when, and who. Included in the middle is the brief problem solving and how to overcome obstacles which may occur while making this behavioral change. After completing this initial adherence consult, set a date for the pharmacist to contact the patient and follow up with them. This can be either over the phone or in person. It can really help with accountability and to let the patient know when someone will be contacting them again. An adherence follow-up documentation form is available through the toolkit and can be filed with the follow-up date in the pharmacy. This documentation form summarizes the encounter and allows the pharmacist who is following up to recall the initial conversation and ensure the patient gets that follow-up that has been promised. So overall, I wanted to thank you for joining us today to discuss how you can incorporate adherence interventions into your daily practice. If you have any questions, please feel free to reach out to Steve or myself. Our emails are listed for your reference. Thank you.